firmly than they have been in recent times.
Let's get into a few calls. Des at Wynnum for the Premier. Go right ahead.
Hello, Premier. Good morning.
G'day, Des.
Hi. Premier, I should mention that I'm the Assistant Secretary of the Queensland Nurses Union, so just to put things
good on you.
That's good. Fine, yep, sure.
In your the 2012 budget papers, you said that the government, and this is in the context of the closures of aged care services in the Brisbane North District Health Service, and also an announcement last night by your CEO for Brisbane South that the Moreton Bay Nursing Care Unit will also close. And that seems to be consistent with what you've said in your budget papers, which said the government will be able to seek opportunities to work with the private sector to more efficiently deliver aged care and other services and to explore other means of more efficiently using the funding which they are provided with.
Mm-hmm.
Now, in relation to my question, I just was wondering if you could give a view on what, given the demand for aged care places currently and the ageing of the population, what effect you think the removal of 280 aged care places in the Brisbane North Health Service and more than 140 at Moreton Bay Nursing Care Unit in Brisbane South, what effect that will have on the removal of those places out of the system on waiting lists for aged care places? And further to that, what effect will that have on with the removal of those beds on the waiting lists in the acute hospital sector? Because obviously many of the patients waiting placement go into public health nursing homes.
Des, just on that point, that includes Eventide, of course, yeah?
Absolutely, Eventide as well.
Okay, let's hear what the Premier says.
Okay, well, look, the first thing I just want to say on anything in relation to any sort of closure is that the full expectation of the government is that every single person who may be impacted, and of course their family and carers, will be looked after. So this is about a change, though, that reflects the way the system should be set up. The federal government are responsible to fund aged care. That's their responsibility. And what we have is a historical situation where we have aged care facilities that have been run in the Queensland public health system. Now, one other bit of context I've got to give people is that there's a lot of talk about cuts and things like that. Well, let's look at the facts. The health budget this year is around $12 billion in this state. It was increased by $816 million. That's a 7% increase. So any talk this particular issue is about cuts, or indeed, the stories we get about two people going here or 15 over there or whatever as a result of some sort of budget cut to health is nonsense.
What is it about then?
Well, it's about who should do certain service provision and where should it best sit and how do we best use the resources we have. So in health, what we have done as a government, consistent with what we promised, is we have set up 17 hospital health boards across the state. We have a chairman in each one and board members. They are people from the relevant communities. So they are people who live, in Brisbane North or Brisbane South. They are clinical people of the highest standing. So, for example, on the north side, it's Paul Alexander, who's a Surgeon General of the Australian Defence Force, Order of Australia, as I recall.
But they're not from the local communities, Premier. That's not correct. That's misleading.
I'm sorry. Well, okay. Well, if you want to...
Their appointments are based on their skill set, not on where they come from.
Well, Des, they are from local communities.
They're not. If you ask, I was at the community forum last night at Wynnum with relation to the closure of Moreton Bay and Wynnum hospitals, and it was very clear. The community was asked that very question: do you live in the local community? And none of the people from the board live in the local community.
Well, Des, if I can answer, there are health boards that cover a basket of hospitals, but I think it's fair to say that the people who are on those boards, and people can go on the health website and see who these people are highly qualified, and they come from relevant communities. So, for example...
that's fine. That's fine. Premier, hang on. That's fine. Certainly, they are highly qualified. No one has an argument with that. But don't pretend for a minute that these are people who are community-based, because they are simply not. They are people who are private practitioners. or their senior administrative staff within the health system.
Des, can I just
not from the local community.
Okay, lest we get bogged down on that point, and there's difference of opinion there. Des, can I ask you what your particular concern is that you'd like to put to the Premier on this? For instance, a guarantee about places for those who are there now.
Greg, I'd like to actually answer the question.
Well, hang on, Premier. Let me. I've been asked to put a question to you,
and then the Premier will have the final say.
Absolutely, and the question is, I'll go back to my original question, what effect will this have on the system that your government is responsible for managing in relation to the problems that we're experiencing currently in the acute care system with a lack of places in the aged care sector, and what effect will that have on families and communities who are waiting for places to get into the public sector aged care residential areas now and into the future? What are you going to tell those people in relation to the plans that your government is in?
Okay, Des, let the Premier respond to that.
I'd love to answer Greg, but if he wants to sort of continue to interrupt on issues about who's on the board and whatever, and I want to deal with that. I was in Gladstone the other day. The health board that looks after Gladstone and Rocky in central Queensland is constituted with people from that community. Now, I'm not saying I'm not going to say that for every hospital there's a person from Wynnum and there's a person from here and a person from there. What I'm saying is there are people from our community. So across the state, 17 hospital health boards, there are people who are skilled, independent people who are there to run the basket or the portfolio of hospital and health facilities that they have. And the point I'm making is they have sat down and looked at their job, which is to provide public health support to our community, a public health system. And again, I say the federal government are responsible for the provision of aged care. They provide the funding. So what's the opportunity here? The opportunity.
So you're wanting to get out of aged care?
Yes, exactly. And that is that's what they have decided to do, because their mission is to make sure that people who want hip replacements or want to front up on Saturday night because they've been injured in a car accident get treated. And it's about where the resources should go. But what are we going to do about it? Well, what we're saying is that, say, a facility like Eventide, there needs to be a careful look at how the people who are currently being cared there can be looked after both now and in the future. Eventide, some of Eventide is actually quite run down. The opportunity is there for the private sector, in partnership with government, to actually look at how they can provide replacement aged care facilities with federal government funding. And again, that's the federal government's obligation from our tax base, and actually look after those people. Now,
but is there a guarantee there? This is important. Is there a guarantee there for those people currently in Eventide and other places like Eventide?
That's why I said at the very beginning, people will be looked after. It's again, if I go back to another piece of nonsense that's been peddled by the Labor Party over the last few months, is this issue about these caravan parks. At the very beginning, I said it again, and I'll say it again today. Every person who's currently in one of those caravan parks that shock horror of the state government are selling will be looked after. And indeed, there'll be at least an 18-month to 2-year moratorium on any change of use. But I've told Dr. Flegg that anybody who's there will be looked after in terms of the public housing system. So again, I say the same thing about Eventide. But the point I'm trying to make here is that we need to do the things that the state are meant to do, make sure the federal government do the things they're meant to do to stop this duplication, look after the people concerned, and also leverage the fantastic assets that we have, which are land and existing facilities, which can actually be then leveraged to provide new aged care facilities. Now, if people are really doubting my sincerity, in the period from 2008 on to about 2010 when I was Lord Mayor, go and Google this. I had an aged care task force, and I did a whole lot of work to actually change the city plan and to have new planning regulations so we could do this in Brisbane. And I'm passionate about ensuring that with an ageing population we can do a better job. But the funding source is from the feds, and that's where it ultimately needs to be provided for.
But Premier, that's where things become problematic, don't they? And I noticed this new plan yesterday to the out of the crisis plan for the Bruce Highway, which sounds terrific. And when you look at those numbers, the number of people getting hurt and injured on the Bruce is just, it's